Stop! You're wrecking your skin barrier. Hey guys, Dr. Daniel Sugai. I'm a board certified dermatologist. So today we're going to talk about the 5 common habits you are doing when it comes to destroying your skin barrier. So I see patients in clinic and online very commonly make these mistakes. And so we're going to go through all 5 of these habits that you might be doing and that might be contributing to your red irritated face, where you wake up with a swollen red face and it hurts to just move your mouth and it feels too squeaky clean and tight. Those are all manifestations of a damaged skin barrier. So the skin barrier is your top layer of skin. It's the top part of your epidermis, which is your first layer of skin. Underneath that is your dermis, where you have collagen, elastic fibers, and blood vessels and such. And then below that, you have subcutaneous fat. At the epidermis, though, you have keratinocytes, and you have this stratum corneum at the very top. That's just pretty much dead cells that are there trying to keep the moisture in the skin and all the layers below, and also helps keep the bad things out of the skin, like microbes, allergens, irritants. What we want is an intact skin barrier as much as possible, and that's why we talk about nice ingredients with ceramides, like CeraVe products, like their CeraVe Moisturizing Cream. They have 3 essential ceramides that are skin identical. They fit into the holes in our skin to help seal and glue together our keratinocytes and keep our cells nice and happy and keep the hydration in the skin as much as possible. Whereas Cetaphil will work on the skin barrier in other ways with glycerin, panthenol, and vitamin B3 or niacinamide, which has been shown to help repair the skin barrier. And when we look at the skin barrier, we will measure certain things like hydration, look at corneometry, where we get a probe and put it on the skin, and we can measure how much hydration is in our epidermis. Also, we can have another probe that will look at evaporation, how much water is leaving the epidermis, and that's called transepidermal water loss. So you want your hydration levels to be high and your transepidermal water loss, or TEWL, to be low. So the more intact the skin barrier, you have less of that water leaving the skin. So how do we avoid damaging the skin barrier? Number 1, wear your sunscreen every day. If you're gonna go outside and it's a windy day, try to avoid really windy conditions. And also, when I was playing golf in Mexico last year, there was a lot of sand whipping my face. And when we were done playing, my lips, my face felt really raw, because they've shown that wind will slough away your epidermis, and that top layer of skin will really slough away the stratum corneum. And also, we had sand from the sand traps just flying in our face. And that was also just it was almost like a St. Ives scrub, walnut scrub on our face, the entire 18 holes. You gotta really protect your skin barrier by physical means, from physical factors. Wind, sand being flown at your face, plus sun. Sun will damage your skin barrier. It's pretty much just an attack on our skin when you have UV radiation. You know, you're gonna respond with tanning, and tanning is a manifestation that our skin's under attack. You're trying to make more pigment to protect our skin from that UV damage. So wear your sunscreen. Wear water-resistant sunscreen if you're gonna be sweaty, if you're gonna do water play, and that's number 1, right? Dr. SPF always talks about sunscreen every day. Recently, I've been using Neutrogena's Ultra Sheer Face Sunscreen. This one is titanium and zinc oxide, and for SPF 70, rubs in quite well. Does have a very small white cast, but not as bad as, like, say, CeraVe's SPF 30, their hydrating mineral. That one is just crazy, right? And also Cetaphil, their sunscreen, water-resistant sunscreen, can be pretty white casting as well. This SPF 70 does a pretty good job. Okay, now moving on to physical scrubbing. When you're washing your face, I don't like those cleansing brushes. I don't like loofahs for your body or your face. If you're gonna wash your body, use a nice soft washcloth. Don't use any scrubbing brushes. I don't like dry brushing. All those things are just physically destroying your skin barrier. So I'm not into physical exfoliation at all. If we're meant to have physical exfoliation to that degree, we would be born with bristles on our fingertips. Don't do that. I'm more into chemical exfoliants like salicylic acid, benzoyl peroxide, to help clean out the pores in our face, plus gently exfoliate the skin, just clearing out that dead skin that needs to come off our skin. Because the opposite of that would be if we have too much dead skin buildup. It's called hyperkeratosis or retention hyperkeratosis. We had that creator who came out with the caveman trend where she said she didn't wash her face for many weeks to months. We found out maybe she was making it up. But we do see this. We have patients who have psychiatric illnesses, dementia, and they're not washing themselves all the time. They will have this terra firma retention hyperkeratosis where you get really thickened skin where the dead skin just kind of piles up. So to gently exfoliate, I have patients use Cetaphil's gentle exfoliating SA cleanser and also like Amlactin cream. Not so much on the face, but say on their neck, their scalp, areas that need that nice gentle chemical exfoliation. We can also go too far the other direction where we're gonna use too harsh of chemical exfoliants. So I don't really care for the ordinaries, AHA, their exfoliant solution that leave on that vampire purplish red solution. That chemical peel like effect that patients are getting is nice in terms of that deep pore cleaning action. It's really exfoliating the skin, but I've seen patients overuse it, and I'd say you would use that like once a week. It's so powerful. Summertime, you gotta be very careful with the sun. So I would say be careful with strong leave-on exfoliants. I've even seen patients get irritation from Paula's Choice BHA solution. So leave-on exfoliants, be very, very careful, especially if you're using a retinoid. So just be careful. Number 4, mixing skincare inappropriately. I love AlphaRet by SkinBetter Science because it's already compounded with the lactic acid, glycolic acid with your retinoid. But I've had patients who came in because they were trying to mix like the ordinary's glycolic acid with their retinoid, and they were getting just terrible irritation. Vitamin C serums can be mixed with retinoids, but some patients just jump right in and mix the two together, and ascorbic acid alone can be irritating. Retinol alone can be irritating. So be very careful when mixing different actives. I like to do is have vitamin C in the morning, your sunscreen, and then at night use your retinol. Try not to put them together. If you end up doing it, you're increasing your risk of irritation. Also, same for lactic acid, glycolic acid. Exfoliant, that's leave-on, and you're gonna layer it with your retinol. Don't do it. If you're gonna do an exfoliant like we talked about 2 to 3 times a week, I would actually consider skipping your retinol those days that you are exfoliating, just so you don't run into trouble and wake up with a damaged skin barrier. Okay, next, this is huge. Using too much retinol or tretinoin. They're both vitamin A derivative medications that are great. There's a lot of science behind them. It can increase collagen production, help with hyperpigmentation, help with our pores, clean out our pores. But people get too excited and they apply way too much retinol. You just need a pea-sized amount for it to work. Let's take, say, the Adapalene by La Roche-Posay. This is great for mild acne, and you just need a pea-sized amount, I promise you. Because if you use too much, you will run into trouble, and that I've seen so much. So a pea size is that amount. Sometimes it comes with a pump. 1 pump is all you need. So there you go. 1 pea for your entire face. Separate that into 2 parts. Dots in the face, don't forget your nose, and then connect the dots. It's just a thin film, and I like to use it at bedtime. I see people putting dot, 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 dot of tretinoin all over their face, and then later on you're wondering why they come back and saying, I give up on tretinoin. That's the reason, you're using too much. Also, they're applying it on their eyelid skin, and I always say, only use a dedicated eye retinol for around the eyes. Don't put tretinoin. I wouldn't go putting even Differin or La Roche-Posay's Adapalene on the eyelid skin per se. I always just keep it outside of the orbital bone. And you could put a little bit around the mouth. Just gotta be careful because this is a very sensitive area as well. And always moisturize after you apply your retinol or tretinoin or Adapalene, okay? So just keep it to a pea-sized amount. And expect about 2 to 3 months for it to kick in for acne, 4 to 6 months to work on hyperpigmentation, 6+ months for collagen and wrinkles. Okay, so if you do have a damaged skin barrier, what do you do? First of all, stop all actives. Stop your tretinoin, your Adapalene, your retinol, your vitamin C. Definitely stop the exfoliants. Just stay with the basics. Basic things like Vanicream facial cleanser. Once a day just to wash your face. Using a mineral-based sunscreen. Like we said, Neutrogena's Ultra Sheer SPF 70 has only titanium and zinc. I love sunscreens with chemical UV filters, but sometimes that can irritate your skin when the skin barrier is damaged, especially when the sunlight hits those chemical UV filters. Some of the byproducts might irritate your skin. So I'd only stay with mineral only. Vanicream sunscreen, Cetaphil, CeraVe, Neutrogena mineral only, okay? And then next, consider moisturizing creams that will help soothe the skin. Just use a small amount of Vaseline if you're raw, especially like around the nose. I like to use it around the eyes when I have tears that run down. This is a little landing area for my tears. I wake up with redness and irritation there if I do not fall asleep. With a small amount of Vaseline or Aquaphor there. CeraVe Healing Ointment works well too. Next thing would be to consider a nice soothing moisturizer. La Roche-Posay Cicaplast Balm has madecassoside, which is soothing, and it also helps with healing, and has shea butter, panthenol. So that's a great one to consider. Another great one that you can consider would be Avène's Restorative Protective Cream. That's another great option. Both have their French thermal spring water, and it's also good for kids as well. So consider those products when you're trying to repair your skin barrier. Stick to the basics, and then when you start feeling better, like your skin is back to normal, you found your equilibrium again, then add things in slowly, one at a time, maybe keeping it a week or 2 weeks apart when you start adding in your retinol, your vitamin C serum, your exfoliants in slowly, okay? So I hope this video is helpful. Please hit the like button. Please subscribe to the channel. Please share with your friends who are into skincare. Drop a comment down below on your rescue skincare products when you have a damaged skin barrier. Hit the bell notification because we'll be coming out long form videos every Saturday. Hope this helps. Peace.